Your body is a self-healing machine. The mistake is to limit your body's potential for healing through your own and medicine's bias. The bias is, well, this is normal. Your brain fades. You have a senior moment. Nonsense. Your brain should never wither. So one of the benefits of testosterone, it is a neurotransmitter, folks. It's critical for good brain function. It's critical for accelerating the movement of electrical impulse from one neuron to the next. Speed of transmission corresponds with formation of new memory. Your testicles, like your pancreas, like your thyroid, like your adrenal gland, produces hormones. Now, if you went to your doctor and you were feeling tired, constipated, gaining weight, maybe a little depressed, and your doctor tested your blood and said, well, you have hypothyroidism, your thyroid gland is not producing adequate hormone. You would then expect the doctor to address it by replacing what's missing. Suppose the doctor instead said to you, well, your thyroid's low, but you know what? For a guy your age, that's okay. Not so cool, is it? Now let's flip it to the testicle. What makes that glandular organ so different from every other hormonal producing organ in your body that medicine has collectively decided to ignore it while it fades? It's a historical anomaly. There's nothing normal about having your testicles wither. It's a historically accurate fact, right? Human beings, Homo sapiens, we're born, we grow to maturity, we reproduce, then what happens? Yeah, we die. And before we die, we wither, all right? So that's a historical arc. From a Darwinian perspective, the world doesn't need us anymore at this age. We can leave, but we'd rather not. This is why we have a frontal lobe, so we could think through things. So in the next few minutes, we're going to discuss the role of testosterone in your health, vitality, the role of testosterone for the span of your life. Should you do this? Why shouldn't you do it? Should you ever stop it? What are the risks? What are the benefits? So let's dive into this because, as you could tell, my advocacy is to live vitally in every regard. Your body is a self-healing machine. The mistake is to limit your body's potential for healing through your own and medicine's bias. The bias is, well, this is normal. Your brain fades. You have a senior moment. Nonsense. Your brain should never wither. So one of the benefits of testosterone, it is a neurotransmitter, folks. It's critical for good brain function. It's critical for accelerating the movement of electrical impulse from one neuron to the next. Speed of transmission corresponds with formation of new memory. Word finding difficulty, those hesitations, they may be signs of inadequate testosterone. Now I'm focusing on men, but ladies, you're equally at risk. So brain function correlates. Immune function correlates. Testosterone has been known to enhance immunologic function. How about preservation of muscle? You can't grow muscle, folks, without adequate testosterone. Y'all remember being 8, 9, 10? I do. Little scrawny kid. Can't wait for the day I can actually grow muscle, I thought. Didn't happen until puberty. Didn't happen until testosterone came. At the back end, as the testosterone leaves, you can exercise all you want. You're gonna slowly fade unless you put back in what's missing. This is so elementary to me that I have difficulty understanding why medicine is so resistant. Maybe it's because it's largely a generic pursuit. Maybe it's because there's not a huge constituency benefiting from it. I don't know. I think a lot of it has to do with a bias against, well, vitality, against sexual energy, against anti-aging. The concept of aging as a normal process is a fallacy. It is a variable dynamic. We need to age chronologically. At some point, we need to die. But everything about aging that we consider to be normal as a part of it is modifiable. There is no biological requirement to age in the traditional manner before we die. And testosterone is foundational to that. How about the fear factor? This is buried in historical anomalies, misrepresentations, paralyzed thoughts of prior concerns. Prostate cancer? Nope. Initially fearful that it would increase the risk of prostate cancer. What do we know? There's a higher incidence of prostate cancer in men with low testosterone. Now, that's not to say that replacing it will lower that risk, but it is to say that there's no correlation of enhanced risk, not only based upon observational experience, but research studies. How about heart disease? It's going to cause hardening of the arteries. Nope. The best studies have not shown evidence of increased heart attack and atherosclerosis. What other things are we fearful about? Blood clots? Well, testosterone does transiently make the blood a little sticky for the first couple of months, then it stabilizes to a baseline. So the entry level into it may have some mild increased risk, but it is quite rare to see that manifest as an actual event. The fear factor about testosterone is that it's going to make you aggressive. Quite the opposite. The grumpy old man, or for that matter, the grumpy old woman, is an individual likely deficient in testosterone. Testosterone has a calming effect in the vast majority of people. Irritability, depression, short-temperedness, anger, these can be symptoms of testosterone inadequacy. And it's not an absolute. You have to know the symptoms you're pursuing, and you have to discuss it in the context of a clinician who's enlightened toward its use. And that's not a universal phenomenon. I'm of the opinion, based upon my research, and I share this opinion with other like-minded colleagues in the space of anti-aging therapy or human andrology, the study of testosterone therapy, that every man needs testosterone or they're going to suffer a negative consequence. The only question is when to start it. Now, if you came to me and you said, hey, I'm 60 years old, I feel like King Kong, I'm awesome, erections are great, libido is great, I'm killing it in the gym, I'd still put you on testosterone. Why? Because it's anticipatory. We know what comes next. Folks will say to me, but my father lived to be 90. My grandfather lived to be 92. Granted, what do they look like? Were they robust? Were they tall? Were they muscular? They likely shrank. They likely withered. This paradigm, this perception of what aging should be, can become a self-fulfilling prophecy unless we break away from that river of inevitability, the conventional pathway. I'm embracing this for you, for us, for all mankind, right? Let's live vitally. My goal for you, all my patients, I want to live with great energy, vitality, and then die suddenly after a brief illness at an advanced age while I'm in good health. To achieve these goals, we must maintain musculoskeletal integrity. Most Americans spend roughly the last 10 years of their life in some form of infirmity. A lot of that has to do with musculoskeletal. So now we know testosterone supports your brain. It supports your mood. In fact, I've used it to treat depression and anxiety in men and women to good effect. What else can it do? Bones and joints. If you have back pain, if you have arthritic knees, an arthritic hip, testosterone is your friend. Muscle begets bone health, begets joint health. One of the most important variables to keep your joints healthy is the power around that joint. Now, I happen to have bone-on-bone arthritis in my right knee and my right shoulder. Yeah, a little reckless in my youth, got smashed up a bit. All great fun. would not trade it for anything. But the idea that my knee and my shoulder need to be swapped out for metal because they're bone on bone, by the way, bone on bone is an absolute fallacy. How do I know that? Well, because I can do this with my bone on bone shoulder. Bone on bone implies petrified adherence of the joint. If you can move that joint, it ain't bone on bone. There is a microscopic layer of cartilage called the articular cartilage still functioning within that joint. Now, it may look ugly on x-ray. My knee on an x-ray looks like somebody put a bomb in it, but it doesn't hurt. I was at the gym this morning jogging on a treadmill because I keep it strong. My point is that the testosterone is critical for joint health. So many of my patients report a decrease in their pain syndromes, muscle pain, fibromyalgia, chronic back pain, when hormones are supplanted, are replaced, and at their optimal levels. So bone health, joint health, brain health, sexual vitality. Just did a podcast on that. You could tune it in as well. It's a component thereof. How about skin quality? The skin is hormonally receptive, and testosterone maintains skin integrity and elasticity, both for men and for women. So hopefully I'm getting you engaged, and you're going to talk to your doctor about testosterone therapy. Now, unless your doctor has advanced training and has confidence in regard to anti-aging modalities, this may be a little bit of a conversational dynamic, right? Blood levels never determine whether or not hormones are needed. Never. The only reason that I get blood at the beginning is to create a baseline and to make sure there are no reasons to avoid testosterone therapy. Now, what might those be? If you have a PSA that is above 10, in some cases 20, it's worthy of a moment of reflection. Now, I treat patients in my practice with high PSA who want to be on testosterone. There is a safe way to do that, but getting a baseline has merit. What else? A blood count. One of the more common genetically inherited disorders amongst men is hemochromatosis, which is a form of iron storage disorder that causes an elevation in the blood count, in the iron level. This type of excess iron can cause damage to your liver, to your kidney, to your brain. It's quiet and it accumulates over time. And because testosterone therapy will stimulate the kidney to make erythropoietin, a natural process that then stimulates the bone marrow to make more red blood cells, you want to get your blood count evaluated. The blood count going up is not a problem unless it goes above a certain threshold. We call that erythrocytosis. That's one of the potential consequences of testosterone therapy. Blood count going higher. In some cases, donating blood is recommended. So we've got a few things we want to screen for, global health, cardiovascular health. Now, what about that level? There are basically two forms of testosterone to test, the total and the free. I'm going to give you an example using a pen. I have a prop. Got a prop right here. The studio comes fully equipped. Okay, so here's a pen, and here's another pen. So if you said, how many pens does the Doc Petteruti have? The answer would be 2. But imagine that I am a sex hormone binding globulin, right? And I am bound to this pen, which represents testosterone. Now you would say, how many pens are there in the room? And the answer would still be 2. But only one of them is functional. The other one is bound and can't work. That's the difference between total testosterone and free testosterone. It's the free testosterone that does the work. A little bit harder to measure, not commonly ordered, but worthy of acquiring. So you want to look at total and free testosterone. No matter what the level is, if you're having symptoms and you're age appropriate is a relative statement. I've had men in their 30s with symptoms of low testosterone who respond to therapy. So let's outline those symptoms so you know what to look for. I mean, the most glaring, loss of libido, erectile difficulty. Those two oftentimes are triggers. More subtle symptoms, lost confidence, depressed mood, low energy, especially late in the afternoon. I come from work and I crash on the couch. Lack of motivation, lack of initiative, difficulty recovering from workout, after the gym, skin quality loss, muscle loss. These are all more subtle symptoms of low testosterone that are worthy of evaluating and considering treatment. So you have those symptoms. You're being evaluated. By the way, make sure they check your thyroid because these things can overlap. And you decide to go on testosterone. The next question, what kind of testosterone? How should it be applied? There are pellets that can be implanted, the topical creams, patches. There's a new drug out that's an oral form, and then there's injectable. So let's review. I don't like the new drug. I don't trust it. The problem with oral testosterone historically has been concern about liver issues because it metabolizes through the liver. Now, I talked to the rep for the company, and they reassured me that it's totally safe for the liver. And I absolutely don't believe that. I don't believe it. No, it's a rep, right? They're selling stuff. Number two, you got to wait. Let some other people try this. Maybe 5 years from now, I'll have a different opinion. But it's also a proprietary drug, kind of pricey. Topical creams, totally reasonable. A little sloppy, a bit of a nuisance. The absorption can be somewhat variable. However, it's totally cool to use, particularly if you don't mind applying it every day, and if you are not inclined to want to do any injection, which is my preferred method for men, many women as well, but it's a once a week, typically it's a once a week self-administered injection. The dose varies depending on response. When it comes to dosing testosterone, it is never judged based upon subsequent blood level. So if a gentleman comes to me in a follow-up visit and says to me, "Thank you, doctor, I feel fabulous, my energy is great, libido is back, my muscle mass is up, my fat mass is down," that's a success. If the blood level comes back at 400 or 500, there's no value in pushing the dose higher just to get to a different number. Now let's flip it around. Suppose he's telling me how great he feels, and suppose the threshold for my lab is 900, and his blood work comes in at 1200. There's no harm in high levels. The lab parameters are a little bit arbitrary as long as there's no negative effect. We talked about elevated hemoglobin and hematocrit, right? That can be monitored for. Elevated estrogen. Some of your testosterone will naturally convert into estrogen, which you must have. If you have no estrogen, your bones can get weak and it can be counterproductive to your libido and your energy. If you have too much estrogen, you can grow man boobs, and that's not so cool. And it'll undermine the benefit of testosterone. So there's a sweet spot for estrogen, depending on the lab that is utilized. My target zone for my patients is between 20 and 40. It can vary depending on the lab's parameters. So that's something to be mindful about. It would be one of the reasons to consider modifying the dose. So testosterone injectable, we talked about, topical creams, pellets, I almost never use. They work, they're safe, but unlike women who do very well with one little tiny pellet, men sometimes need a bunch of them. It's like buckshot going in the buttocks. It's good if you have limitations, cognitive impaired, or functionally just have trouble keeping up with things. I have a few patients that benefit from that approach as well. How about preserving your testicle? I get this question often. What if I decide to come off testosterone? No problem. You just stop. You won't lose value that you've acquired completely, but you will go back to that which you were. When testosterone therapy is being administered, it is incumbent upon the provider to do things to preserve your testicles. The testicles do more than make testosterone. They make other supportive hormones. They're a component of your health. Giving testosterone without something to support the testicle causes the testicle to shrink. Over time, will become completely atrophied, the size of a raisin, and cease functioning. By virtue of supporting testicles, and that can be done with several different interventions. There is clomiphene or Clomid, an oral capsule. There is N-clomiphene, a isomer that can be compounded, another oral agent. There's HCG, human chorionic gonadotrophin, which is an injectable. There's gonadorelin, another compounded injectable. How you preserve testicles is really incumbent upon the doctor to guide you toward. That you preserve them, I think, is critical. So testosterone, absolutely. Preserve the testicle, you bet. Monitor estrogen, blood count, absolutely. How about other potential side? Can you lose your hair? Well, yeah. If you're prone toward androgen, that is male pattern alopecia, and you're on testosterone, there's a risk of exposing the inevitable hair shedding that is destined to occur. Now, there are things that can be done to try to balance that risk. In some cases, there are topical creams. We have developed one in intellectual medicine. If you email us, we can certainly consider. It's a prescription compound that we made. It's a unique product. It works great. What I like about it, and I do use it personally, is that it works on the hair follicle without getting significant blood absorption. You can use drugs like finasteride, Propecia. These drugs block DHT. So some of your testosterone will go into estrogen, and some of it will metabolize into DHT or dihydrotestosterone, a really potent form of testosterone that is helpful to libido, helpful to the beneficial effects, but also more stimulating to the prostate and hair follicles. So going on a DHT blocking drug at the same time you're on testosterone to preserve hair, if you're at risk for that, is a reasonable combination to have. So here you are on your testosterone. I get another question. How long should I stay on this, doc? And my answer, until they close the lid. Like, why would you stop? The only reason to stop is you're on the cusp of death, or financially it's not sustainable, or philosophically you just choose not to do it. By the way, that's totally cool too. How you live is your prerogative. My job is to educate and inform. It's not to impose. Any doctor that attempts to impose a treatment, I think, is deviating from the primary focus, which is you, right? Give me information, doc. Don't tell me I have to. I must. It's required. You have to get your colonoscopy. You have to get your mammogram. You must get a prostate biopsy. There could be sound reasons for these recommendations, but they're never a requirement, right? Independent life, that's most critical. The choices you make, most critical. You choose not to do testosterone, totally cool, doesn't make you a bad person. I want to age organically. I want to do my best. Then do so. Can you do things to help testosterone levels other than take testosterone? Yes. Strength training, muscle strength training, weightlifting in particular, been shown to have some value. Keep your percent body fat in check, shown to have some value. But even a lean man with optimal health habits is going to have his testosterone levels decline. It's just inevitable. So you have options. Now you know it's safe. Now you know you could do it for the rest of your life. Now you know you don't have to fade. Now you can be confident that you're not going to harm yourself. So, my wife asked me a while back, if I knew I was dying, would I regret anything? And she's referring to all the stuff I do, right? I do hormone therapy, I do supplements, a bunch of other things we'll talk about over time. In a nutshell, if it's out there, it's credible and safe, and it has potential to keep me vital, sign me up. So yeah, I do testosterone therapy. The answer, no, I wouldn't regret anything. We all leave the stage. How we live is what we control. That we die is inevitable. How we die, not necessarily our prerogative, but we can tilt the field a little bit, right? Protect against dementia. Protect against withering. Do not become disabled. One of the leading causes of disability is sarcopenia. It's a fancy word. It just means withered muscles. You got to get up and down stairs, people. You got to open a jar, people. You got to get in and out of your car. These things matter. Think young, walk fast, lift weights, take testosterone. Another thing I encourage my patients to do, an occasional hormone holiday. About every 3 weeks, you skip your testosterone. Why? Because it upregulates the receptors. We cannot test your receptors, but they're there. And by starving them a little bit, the theory goes, you're going to enhance their receptivity. We got to think long term. I've been on testosterone for closing in on 20 years now. It is a sustainable approach. When you take that 3-week holiday, you're going to feel fine. Maybe the 3rd week you lose a little bit of juice, but it's barely noticeable. The body redistributes testosterone in a manner that keeps it around for quite a while. Another side effect worth mentioning, acne. If you're getting pustular corporeal acne on the chest, on the back, that's a sign of testosterone-stimulated acne. You can lower the dose. In some cases, I'll have my patients split the dose into twice a week. Some people are a lot more sensitive to testosterone than others. Testosterone for life, yes. Living more vitally, you bet. Testosterone for bodybuilding, not so much. You're 23, you want to grow muscles, do not do anabolic steroids. Can it be any more clear? Right? Body dysmorphia is a horrible thing. Your biceps being an inch bigger is not going to change the arc of your life. I get it, guys. I've been there. Listen, I think I'd rather die than wither. And I've been in the gym since I was 16. And I like lifting weights and I like having muscle. But for God's sakes, don't crush your virility in the process. Anabolic hormones, these are the type people get off the internet. These are the illegal type. These are the ones that stimulate incredible muscle growth at a price. Damaging neurologically, damaging sexual vitality. And I've seen some of these patients in my practice years later. Sometimes recovery is not possible and they end up on testosterone in their 20s. How about things that stimulate testicles without using testosterone? They don't work. All right, that was a short response, but they generally do not work. Anything, I don't care what that baseball guy is telling you about, T-Rex 101, whatever they're promoting out there. Look, it's placebo nonsense. If you're above the age of 40, in my vast experience, and you're manifesting symptoms of low testosterone, almost always you're going to need testosterone itself to get a remedy. In some cases, a testicular stimulant like clomiphene, N-clomiphene, gonadorelin, HCG, in some cases you could try that and it may have value, but that's uncommon. Over-the-counter stuff, it's a failure. Supplements have value and I use them in certain settings, but if you have issues with testosterone, testosterone is the remedy. So keep your money in your pocket. Do not do this, people, blindly over the internet. It is worth the price to get a clinician who is progressive, who can help guide you. Life, vitality, anti-aging, it's more than just testosterone, although I consider that foundational. The elements of vitality and anti-aging, control percent body fat, replace hormones. The other pieces we'll be talking about in podcast includes protecting your brain. It's a whole nother topic. I'll defer to another podcast. Your brain gets protected by, ironically, being on hormones. Lower hormones correlates with increasing dementia risk. Women who've had hysterectomies, men who have had androgen deprivation therapy, never let them castrate you guys. Never. I'd rather die of prostate cancer than invite dementia through testicular blocking therapies. That's a false choice. Mark yourself absent, 0 for 2. So maintaining percent body fat, hormone therapy, lead reduction, we'll talk about in future podcasts. So I'll leave you with a story, one very motivational to me. One of my old patients, this is going back, had to be 15, maybe 20 years ago now, when I was just starting to develop my knowledge, capability, and interest in hormone therapy. And I had a patient, he had stage 4 lung cancer, and he came to see me, and I asked him, how's your breathing? He said, well, doc, this is a guy I was treating with actually testosterone. It's great for cancer patients. How's your breathing? I said to him, he goes, well, doc, dude's 85. He said, the only time I get short of breath, he goes, when I'm having sex with my wife, I get a little breathless. Man, I was floored, impressed, motivated, right? Think about that. 85, stage 4 lung cancer. Takes my breath away. He passed away a few months later, which is a beautiful exit for a wonderful life. The point of the story is vitality uber alles. Hold on to that. All right, gang, till next time. Talk to you then.